Thank you for joining us for an introduction to the Share Virtual Health Record, or VHR. The Share VHR is a secure online portal that retrieves and shows all available health data for a patient that's been gathered from all participating Share providers. You can access the VHR from anywhere with an internet connection and a compatible internet browser. The VHR displays information as a traditional clinical chart, with tabs to separate patient information into groups for easy chart review. In today's video, you'll learn how to log in, how to reset your password, how to search for patients. We'll talk a little bit about consent and how to navigate patient charts, how to send and share reports, and how to filter your search results. So let's get started. There are different ways that you can log in to Share. You may install an icon on your desktop, or you can go directly through an internet browser by typing in sharearkansas.com, which is what we'll do today. Check with your project champion if you're unsure of how to access the system. Once on Share's homepage, on the right side of your screen you will see a Login button. Click the drop-down and choose the VHR selection. Once on the login screen, type in your username and your password and click the Login button. As a first-time user, you will set security questions. These security questions will be used when you need to reset your password. Choose an appropriate security question in the drop-down menu and then answer the question in the text field below and click Save. Please note that you must answer 2 questions. Once you are logged in, the Patient Advanced Search window displays, or you can click on Advanced Search in the upper right corner of the screen. The last name, date of birth, and search reason are the minimum fields required to complete a search. You may complete additional fields as desired. To verify this is the correct patient before opening the record, hover your mouse over the patient name and it will show the last 4 digits of the Social Security number. If this is the correct patient, click the patient name to continue. When accessing the VHR, you must agree to the usage terms and conditions to access the patient's medical information. Click the I accept checkbox and then click Continue to view the patient's medical information. When accessing the VHR, your user role will determine how much information will be available to view. The primary clinical role is given to licensed physicians who need the ability to access a patient's medical record in the event of a public or private emergency. This role allows the physician to access clinical data, medications, allergies, vitals, lab tests and results, etc. In addition, the primary clinical role allows the physician access to the break the glass technology. Now let's talk about the secondary clinical role. Any staff member needing access to a patient's medical record to perform their job function will be given access to all Share data, which includes clinical data, medications, allergies, vitals, lab tests and results, etc. And last, we have the non-clinical role. The non-clinical role allows office staff access to patient demographic information and the Patient Information tab only. No clinical results will be displayed. A patient may choose to opt out of Share, thus not allowing their information to be viewable in the VHR. If you are searching for a patient that has opted out, you will not have access unless it is a public or private emergency. If you've been assigned a secondary clinical user role or a non-clinical user role, you will not be able to view the records of a patient who has chosen to opt out. You will need to return to the Patients tab to perform a new search. If you have been assigned a primary clinical role, you may break the glass by accepting the terms and conditions and clicking the button labeled Unlock Consent Data. You will then be prompted to establish the reason that you're breaking the glass, and you will select the appropriate reason and click the Break the Glass button. Once you're inside the patient chart, you can easily navigate each tab and folder for patient information. Within the patient health record, there are 3 tabs: the Summary tab, the More Patient Information tab, and Patient Documents. The Summary tab, which we have on our screen, displays the important health information about your patient, such as lab results, radiology results, transcribed documents, medications, vitals, etc. The data is displayed in folders and shows the most recent reports available. To access this data, click on the desired report to open. In this example, we will open a lab result by clicking Complete Blood Count. And from here you can view the results of the report. The More Patient Information tab provides additional information about the patient, such as demographics, consent, facilities, insurance information, next of kin, patient aliases, providers, and support persons. This information is viewable by clicking the desired tab, and please note that the Advanced Directives tab is currently not being utilized by SHARE. Now let's take a minute to talk about patient actions. On the left panel, you will see all the patient actions available. First up is Back to List, and this takes you back to the patient search list. Next is the Download Summary PDF. It typically contains the same data as a CCD, but in a more formal format with a table of contents. It can be saved to a file as a document in PDF format. The Share Summary option allows you to send a patient summary in CCD format or PDF format to another secure messaging user. The Send Summary to Me option allows you to send the summary to your own secure messaging inbox. And Configure Layout allows you to configure your patient summary layout for visual ease. Now let's talk a moment about the Share Summary option. To assist in transitioning or referring a patient to another provider, SHARE allows a patient summary to be shared with providers and their staff via secure messaging. If they are a SHARE participant, the provider name can be found in the recipient drop-down menu. If they are not a SHARE participant, you can choose your own provider as the recipient and then enter the correct secure messaging address for the user you wish to share the summary with. First of all, click Share Summary in the Patient Actions list, and then choose Provider Recipient. Under Ad Hoc, choose the format of the document you wish to send, either a CCD or PDF. Fax is not available. Enter the correct secure messaging address for the user you wish to send the email to. If you wish to send the summary to more than one recipient, click the Add Recipient button and add an additional secure messaging address. Click Share Now to send the email and you're all set. And now we're going to take a moment to look at the My Results tab. It's at the top left of your screen. The My Results tab of the VHR may also be referred to as a clinical inbox. If one of your patients presents to a participating hospital, their admission or discharge information along with any test results may be automatically pushed to this tab if the provider is identified as a provider of record with the participating hospital. We refer to this as a clinical encounter. To view the clinical encounter, simply click on the encounter that you wish to view. By clicking on the discharge summary, the report opens for viewing, and you can now view the report and download it to your EMR as a PDF file or share it with another provider or clinical user. To filter the encounters, click the Advanced Search blue link in the My Results tab. It's on the right side of your screen. Select the appropriate filters or search criteria. We're going to select Labs in the last month. And down here in the bottom left side, you can select how many results you would like to see, and then click the Submit button to apply these filters. All of the information matching the search criteria now display in the My Results window. Click on the desired report for viewing. When reviewing the information, users may notice flags to the left of the patient name. These flags indicate the severity of the report and are easily defined by rolling the mouse over the icon or by comparing the icon to the menu on the left. By glancing at the flags, you can easily determine if the results should be reviewed quickly for proper patient follow-up and care. If you have questions or require technical support, please consult our help desk by calling 1-855-SHARE-AR. That's 1-855-742-7327, or you may email support@sharearkansas.com.